Hello, everyone. Thank you so much for being here and coming to this breakout session. We're thrilled to have you today. My name is Randy Posner. I am a board member of Kid in the Corner and past president. I'm your room host today. So welcome for everybody who's here in person and everyone who's here virtually. Thank you for attending. A few notes to go over before we begin. The session is titled From Glimmers to Gaslighting, What Pop Psychology Gets Right and Wrong About Brain Health, and it's presented by Dr. Kari, Millican from Phoenix Children's Hospital. We have about 1 hour for this session, including the time for questions and answers. So feel free to jot down any of your questions, or if you're virtual, please drop them in the chat and we will try to get to them. Housekeeping items, please make sure your phones are on silent. If you need to step out, feel free, but kindly do so quietly to minimize disruptions. We encourage participation. So if you have a question during the session, just raise your hand or again, drop them in the chat. For those of you wanting to obtain CE credits, there's a QR code over there. So that's what you would scan on your way out to complete. You will have to log in and create an account and follow the prompts, and then the certificates are generated automatically. So without further ado, it's my pleasure to welcome Dr. Kari Millican.
Thank you for that sweet introduction. I am excited to be here, talk about this topic that is fun, and I think it has a lot to do with kind of the peer panel that spoke this morning, which I love, and was just blown away by the responses of those young folks that came up to share. And so a lot of what I've got to talk about today is going to touch on some of the things that they shared, which I think is so great. So I'm really excited to be here to chat with you guys. And I want to start out by just telling you a bit about myself. So and I'm sure the laptop that I've got to refer to a little bit, a hard time staying on. But okay, so these are my 4 boys. It's a little blurry, sorry, but I wanted to show a picture of my 4 kids because I will reference some things that I have learned from them in terms of today's sort of pop psychology and share with you some things that could be relatable. And, you know, I really believe that motherhood helps me in my clinical profession and vice versa. Being a clinician really helps me raise my kiddos and attend to the things that they're going through and, you know, to just be the best mother possible. So I have been in the mental health field for about 20 years, and I have worked in community mental health, private practice. I am currently with Phoenix Children's Hospital, where I've been for about 8 years. I started as one of only the very first mental health clinicians at the hospital, and we've built tremendously. And now I have the honor of overseeing our mental health department that's grown to over 50 clinicians and even more with our fellowship and internship program. So we just continue to grow, and we oversee mental health assessments in all of our soon to be 4 emergency departments in the Valley. We have robust outpatient services available. We have an inpatient psychiatric unit where our clinicians are providing mental health support to our inpatients, as well as consulting to the medical floors, where we're supporting individuals and families as they endure medical complexities and the emotional hardship that can create for families, family systems, and of course the kiddos that are experiencing those hardships. So I have loved being with Phoenix Children's, and I really, my passion is in supporting the kind of the parent-child dyad from early on in life, perinatal mental health focused, understanding how brain development early on and brain health impacts us for a lifetime. So that's a little bit about me. And, you know, my kiddos, they range from, sorry, so blurry, but range from 17, my oldest is a senior, down to my youngest, who's 10. And in between, we've got 15 and 12. So you might hear some stories about them today. Okay. Great. So today I really hope to talk to you about this topic of pop psychology, that there's a lot of information, not just for today's generation, but for all of our lives. Pop psychology is something that has been a part of where we get information about psychology and our emotional health, mental health across, time. Today it's just very readily accessible in a different format. And so I'd like to kind of focus on the younger generation, adolescents, and truthfully us too, now that this is so widespread, how we obtain our information, and just to kind of tease out what is trending and what is clinically sound. And it can be a tough kind of discerning between that with all the information we receive. And then anyone that's a clinician or parent or a teacher or wherever you're at, we have the opportunity to sort of educate, to learn some of the language, or use the language, help the language to be used in the right context, and then to guide people towards higher levels of support care if it's needed. So that's kind of where we're gonna go today. All right. The same slide over here. Okay, so what is pop psychology? Pop psychology, when I was growing up, pop psychology was like self-help books that would come out and inspirational quotations, motivational things that you'd read that really boost you and feel good. And I hate to admit, but like the 17 magazine like quizzes, or drama queen, learning about myself through these quizzes. What's your flirtation style? Stuff like that was fun, but it sparked my curiosity about myself, about people around me, about what that means, who I am. Pop psychology can come in a lot of different forms, and in today's world, youth have pop psychology, popular psychological concepts, trends spoken about on, the kiddos this morning spoke about it in social media, on TikTok and Instagram, and in a lot of different places where they're receiving information. And so it is designed really to be appealing to the masses. It's designed not necessarily to focus on accuracy or something that's clinically sound, or to be developed and shared by mental health professionals, but it's designed to promote these topics, and it can be sometimes misleading. And for the reason that it's designed to be shareable and exciting and intriguing and get likes and be reshared and things like that. So that's kind of the gist of pop psychology. Not bad. I'll go into some pros and cons, but this is what pop psychology is and how we sort of hear about it these days. I'm not going to be able to keep this laptop on. Okay. All right. This topic or this slide, I want to share some of the terms that we hear commonly. Again, not all bad terms, but we hear a lot of this psychobabble or these therapy terms used in everyday life that some of it is very accurate, and we use it in our clinical practices regularly. But I also hear it in my world in ways that kind of makes me cringe a little bit. So my first story about one of my kiddos is my 15-year-old, and he's lovely, but it was his turn to do dishes, and there was a sink full of dishes and a dishwasher that needed to be emptied. And I said, Jackson, it's time for you to do the dishes. And he looked at the pile, and he looked at me, and he looked at the pile, and he looked at me, and he said, I don't think I can do it. Last time I did the dishes, and the little, there's 4 of them. We call them the bigs and the littles, because the 2 are close in age, the youngers are close in age. And he said the littles left, I don't know, oatmeal or something in the sink, and I had to scrub it with my fingernails, and it was traumatizing. And I just am super triggered by doing the dishes. I've got to set this boundary. And so, yes, I had that reaction. I kind of looked at him, and he thought he was appealing to my profession and sensitivity to his wellness. And, ultimately, did the dishes. But you can hear some words in there that are very commonly spoken these days, which again, I feel is really great. There's language that younger generations have that, you know, I didn't have before I was in this field. But that sometimes we can hear and kind of, you know, waver from the idea of is this coming from a clinical perspective, or is this sort of, in this case, used to sort of try to manipulate the situation or get out of the age appropriate responsibility of doing the dishes. So I'll throw some terms up here. Please feel free to just like throw your hand up if you've heard it used or misused, or just, you know, kind of more commonly stated these days. So I've got triggered, which he did use, you know. Oh,
remember you're not plugged in.
there we go. All right. Gave me PTSD. I've heard that, like the pop quiz that gave me PTSD or something, right? A narcissist. I've heard that one a lot in relationships. Yeah, they're a narcissist or something, you know. Totally, maybe some of you are dissociating. I don't know. That lecture, that teacher was totally dissociating. I heard that. A trauma bond. Have you ever heard anyone say that? Relationships, trauma bonded or something. Setting boundaries, again, one that he used. Setting boundaries is not a bad thing, but you know, there can be this kind of uncertainty about when a boundary is a healthy boundary or a scapegoat, right? Let's see. Gaslighting. Anyone heard that one? Yeah. As my OCD, I hear that, and not just OCD, other diagnoses. Sometimes we get very confused if, you know, if I like to organize my closet and color code, I'm OCD, but it can be invalidating or insulting to, you know, OCD that can be very, very debilitating. Neurodivergence. One I think that ultimately is great. We have a much better understanding of neurodivergence. But it also sometimes can be overused or misused. Stonewalling, heard that one, yeah. Relationship toxicity, I feel like that's a common one. Like, that's a toxic relationship, get out of that. And for me, because attachment is a strong part of my theoretical orientation, attachment problems I hear kind of frequently. What did I miss? What did you guys, anything you've heard?
Being an empath.
Oh, empath. Yeah. I hear that a lot too. Yeah.
You're not validating.
Yeah, you're not validating me. Mm-hmm. Yep. Anything else you guys have heard? Yeah.
Masking.
Oh,
Masking.
masking. Yes, that's a good one.
Highly sensitive person.
Yeah, highly sensitivity, that like along the lines of that, like I'm an empath. I can't, you know, can't attend to this or something. I'm too empathetic or something. Oh, okay.
Would deflection be one?
Deflection could be one, sure. Yeah. Yeah, you guys have come with some great ones. I think you kind of know it when you hear it. And it's, you know, if you know, the clinical minded folks are understanding that these are terms that we use in our practices and we're teaching about it. But at times we hear these and we wonder if it's taking away some of the true nature of the mental health topics and experiences and strategies that we're working with our patients and clients about. So it's just kind of fun to hear it out there, and then to you know, to help this generation and even adults too discern between some of these things. All right. Let's talk about why pop psychology is so popular. I think for a lot of reasons related to how our brains function. Pop psychology is something that ultimately helps us, you know, our brains seek patterns. We want to, it stereotypes, if you will, right? It helps us to understand little bits of information and kind of come to a quick answer. And here's another one where you guys get to be involved. So just shout out instantly, kind of the first thing that comes to your mind when I start to describe something, okay? So I'm thinking of something you can eat that's red and it's round and apple tomato, yeah. I gave almost 3 descriptors. Sorry, I hope I didn't hit something.
You didn't. I've never really seen that before. Thanks for finding a new one.
But Our brains do that. We start to get bits of information and we want to our brains want to quickly kind of get an idea of what that was, right? I was, is that,
That's what, you just keep going.
oh, okay. I was thinking of a red Skittle. There are tons of things that are red and round and edible potentially, but we hear information and we want to get to an answer, and that's part of our brain's way of functioning, which is not a bad thing. It's a little bit risky when misinformation can come our way pretty quickly and we're jumping to sort of a conclusion or an answer versus waiting to get more details or more information. Let's continue without.
We'll imagine that it's there.
We're gonna just imagine. I should put this in presenter mode then so I can know where I'm going. Yes. Okay, so our pop psychology is popular because it gives us quick answers in a world that's overwhelming. Right? There's a lot to be learned out there. Psychology, for those of us in the fields, you can be in the field for years, whether it's in school or then fine-tuning the art and the science behind the practice of psychological health and well-being. But pop psychology allows us to have digestible information that's maybe coming in these smaller bite sizes. And I looked up some videos that, I'm not really in the like TikTok, Instagram world, so I don't have all the great language, but I found some that I thought kind of helped to display this kind of popularity and understand. But so an overwhelming experience we have is anxiety. Anxiety can be a spectrum, a little bit of nervousness versus full-blown, panic attacks and severe anxiety. But this video I found, it was called "Eat an Orange in the Shower to Cure Anxiety." A viral, video suggesting that, my goodness, and I haven't tried it myself. Didn't get to this, but there's a little concern there for me, as it's not founded in any evidence-based practices. And, it's much easier than investing in years of therapy or medication. I'm gonna invest in oranges. So, but our brains, we really want quick answers. Things are hard. Years of therapy to address crippling anxiety can be really hard. Pop psychology, sorry, I tend to get to talking too fast. Try to slow myself down. But it also, it simplifies things for us. Instead of reading an entire textbook, it's something that you can get in these smaller increments, and it's simplifying something that's really difficult. So I have another one, and this title says, if your ex is your ex is a narcissist if they did any of these three things. Which I don't know what those three things were because I didn't indulge in it, but I think that it can be a bit concerning, but we can be drawn towards videos like that. My ex is making me mad, and yes, I can say they're a narcissist and maybe step aside from anything that I did or whatnot. I don't know, but to learn that there's some validation in this by a 30-second video about these things. Pop psychology becomes very popular for some of those reasons.
Mine can still hear.
Oh, great. Can they see the, yeah, okay, you guys are just missing out. Again, pop psychology is very validating. Algorithms and things like that are designed to get likes and to get shares and to be relatable. So this content that's coming at us strives to be that way, that not to knock horoscopes, right? But it's to be something that can broadly relate to the audience that's watching it. And this video says, if you procrastinate, you probably have ADHD. So I don't know. Some of us procrastinate. Most of us said some things we procrastinate. And in this kind of video, there's something that can happen when you're watching it. And I'd say, I don't want to knock a younger generation, but the exposure is quick and readily available versus where I'm at after years of school and in the field. to discern that that's maybe a symptom or an outcome of a true ADHD diagnosis. But to someone that's seeing that and then sort of like, well, it's not me, it's, it's ADHD. So an opportunity to maybe grow or reflect or make some areas of progress can be hindered by a video that very much validates it. It's not you, you don't have to worry about it, or, just can kind of misinterpret what the intent of that might be. All right. This one says, pop psychology is popular because it helps us cope with difficult experiences. Absolutely. A video I found is healing trauma in under an hour. Now that one, wow, kind of like really made me pause because trauma, complex trauma can take years of psychotherapy. And depending on what an individual is going through, how hard is it? Well, from my vantage point as a clinician, for someone to see a video and suggest that, this unrealistic expectation for what healing can entail. But that is a video that's out there and seems pretty popular. Obviously, like I mentioned, pop psychology is popular because it's easily shared, which is great. Totally different slide.
We'll get you.
I discuss it. Click through. Thank you.
Are you already there?
Yeah. Easily shared. Boom. They're right there. Great. Yeah. Pop psychology also taps into some of our cultural trends. We heard that from our youth today. They talk about they've talked about what's out there, what is available to them. And part of their identity is kind of coming from these pieces of information they're receiving, which has a lot of perks. Another part of popularity is that it is promoting of self-help. Absolutely. Those 17 magazines taught me a lot about myself, right? And so the other two videos that I put on here, though, that I made note of, was one of them was titled "Smile for 60 seconds and your depression will disappear." So I do know that there's a lot of science into our mood and our facial expressions and things like that. And yet a video that says that, your clinical depression could disappear by just, smiling is sort of leads to a false belief about how we heal and how we treat clinical depression. Because the other side of that coin potentially is that, okay, so I have depression, maybe I'm not smiling enough. Like this is creating more shame potentially for my inability to smile more. So there can be some risks there. This one I thought was too funny, I guess, not to pass up. It's a pseudoscience trend. I don't know if anyone's heard of it or would admit to hearing it, but it's titled "Drink Moon Water to Manifest Happiness." Essentially, you put your water outside under the full moon, and it charges. Okay, you know I'm going with this, right? I haven't tried it, but again, it's kind of something that may go viral as a trend, and again promoting sort of some unrealistic expectations that's not rooted in clinical experimental trials and things like that that help to treat clinical depression and yet is trendy, and maybe folks are interested in trying the moon water thing, I don't know, but these are some examples of why pop psychology is really popular. We want fast answers, and there's a lot of information out there. Okay, so I think in sharing some of those videos, I started to hint into some of the risks of pop psychology, but the saying that I say a lot is that destigmatization can lead to desensitization. And just don't say it 5 times fast, because that's really hard to get out. But destigmatization, I don't think any of us would deny that increasing our awareness about mental health, conversations about reducing the stigma for talking about receiving funding and treatment and the right kinds of levels of care for mental health is so important. Fantastic. And yet the pendulum can kind of swing to a space of taking away desensitizing us to be able to discern between the spectrum of mental health diagnosis that we treat. And it can, instead of teaching, you know, that depression or just the emotion of sadness can be on a very long, large scale, from, you know, a little melancholy, which is normal for us as human beings, to clinical depression, which is very debilitating and absolutely needs treatment, right? And all the things in between. One that I've heard is kind of if anyone's, you know, worked in the clinical field, maybe the first time you had a patient say to you that they were thinking about suicide, you just immediately are, you know, more attention. You're wondering in your mind, like, how can I make sure this patient is safe? And doing everything you possibly can to assess a little deeper, get them to the right placement for treatment or next evaluation. And yet, like, if the sayings or things of this nature, gosh, I'm so stressed, I just want to die, or things like that are said more frequently, it can reduce sort of the gravity of that situation in certain settings. So destigmatization, I feel, is great, but I think we've got to just kind of remain cautious about it becoming something that then we're desensitized to. I said a lot of these already, but just to go over kind of, you know, pop psychology can sometimes normalize behaviors, which I heard from the youth panel today is great, where people are talking, hopefully, kind of about some of their mental health concerns, which is great. But again, sometimes the normalization can be interpreted that, well, I mean, I guess if everybody's struggling, my struggles are not really that important, or maybe, you know, just not really taking into account how one individual's experience might be very different. And even the first presenter, one brain is different than any other brain. So that is something that can be kind of a concern. Self-diagnosing, right? As clinicians, when we're assessing and diagnosing patients, a lot of what we are asking comes from self-report. Unless we have the $5,000 to go do the brain scans that hopefully will have more readily available in our field in the coming years. But a lot of our diagnosing is coming from, like, is this an experience? How many of your symptoms? How long? Intensity, duration, frequency, self-report. And pop psychology sometimes can sort of blur those lines in an individual's interpretation of their own experiences. Again, with kind of minimizing severity, not kind of knowing where to draw the line and the intensity of the symptoms. An overexposure, distortions of the truth, so not really knowing the information that's received, whether it's accurate or not. Again, orange in the shower, right? Like if I'm going to eat an orange in the shower, I might not actually reach out for the right kind of treatment, or another one, or yeah, and like seek more of an appropriate intervention to something that is trendy, or moon water drinking, or things that are maybe not clinically supported, and that might hinder or delay the seeking of treatment. Makes sense? I also think, you know, desensitization is in general something I feel cautious about as I'm raising my kiddos. I think that they've asked me before, gosh, I really want to watch that horror movie because I am not scared of it. That's not going to scare me. I'm not going to have bad dreams. It's not scary to me. And I'm like, oh my gosh, like that is scary to me, right? Serial killers should be scary. We need to have a healthy level of emotional response to situations. We don't want to, you know, even work with a patient that says, I'm experiencing anxiety. I want my anxiety to be gone. Well, yes, we want to reduce, and we want to be able to manage, and we want it to be a healthy degree of that emotion, because anxiety keeps us alive. It allows us to feel a little bit of nervousness when we're going to cross the street and want to make sure we're not going to get, you know, hit by a vehicle. And so just again, the idea of us becoming desensitized to things is, in my mind, a bit of a risk factor. Okay, so some of the research shows that platforms like TikTok, Instagram, they are really popularizing the conversation about mental health, which is really cool. And yet, this study from 2024 showed with an analysis of 500 videos with the hashtag mental health tips, over 80% were actually found to be misleading or really inaccurate, kind of maybe intending to be relatable, over the 20% or less that is actually clinically sound documents of what mental health conditions they're seeking to understand and learn about. And just kind of fun fact, the 2025 average length of a TikTok video is between 21 and 34 seconds. I didn't know that, but I was thinking, oh my gosh, in 25 seconds, an individual looking for information about clinical depression or asking, asking the platform about a serious topic can receive an 80% feedback rate of things that are not accurate. Another lovely graph here talks about just sort of the prevalence rate of our growing pop psychology information that's readily available on the internet today. That advice is oversimplified, is not giving misinformation, and only a quarter of it, based on this study, was found to be evidence-based. So I do think that, again, this information is out there. It's growing. It's readily available. We're going to move into some of the pros and the exciting things about that, and yet also to recognize that, unfortunately, some of the things that are coming our direction when we're seeking information from here can be not entirely accurate. Okay. And the final graph I'll show you. The youth did a fantastic job talking about this today. When they're turning to their social media, whether it's for just social media or they're looking at social media as an opportunity to support them with whatever they might be experiencing or going through, it is both a lifeline and a stressor. And so 70%, at least according to this study, 70% of individuals turning to social media to address their mental health or look into what are other people may be experiencing, 70% feel supported, which is kind of cool that they're receiving some validation and some normalization from others that might experience the same thing. And on the same token, there's 60, 40-ish, 50-ish% of these other outcomes that are happening when this is one of the main ways of receiving information on this topic. That sleep issues, as we've heard, is a significant component of our mental wellness. The cyberbullying and the stress that comes from these platforms is very real and is something that maybe is not necessarily outweighing the support. So I think that it's something to consider, that there are pros and cons, and to be able to guide and support our youth and ourselves from this kind of two-sided coin. Okay, I think I have another story for you. All right, benefits of pop psychology. I think there are many. And in fact, I had too many slides on the topic. I had to trim it down a little bit. But I'll tell you another story about something that really reminded me of the importance, especially of this younger generation, where a lot of their information, they're very used to getting information from the internet and from platforms like TikTok and Instagram and YouTube Shorts, where they are getting information and answers very quickly. And not just one, many, over and over and over again, right? My son, he's 17, my oldest, he has been with his girlfriend for almost 3 years, which is a lifetime for a teenager. And they're wonderful. She's wonderful. Her family's wonderful. We just love them. But about 6-8 months ago, she went through something at work that, was difficult for her and caused a lot of stress, and she left that job. And he began to hear from her that she was having a hard time sleeping. She sort of started to retreat from their typical social outings, and she developed some like hand wringing, some traits that he hadn't seen in her before. And then he, unbeknownst to me, kind of turned to his platforms, his way of receiving information on the internet. And, you know, and learned for himself that this is probably kind of an anxious response. She's developed some anxiety based on what she's gone through. And I guess he read about some breathing techniques and strategies, and oh my gosh, there's this place where you can look for a therapist. But then he came to me, you know, and I was, you know, we have a good relationship. But he said, hey, I think that she's struggling with anxiety, and I read this information, and I wonder, like, should I talk to her about this? Should I, you know, can I help her talk to her parents about maybe seeing someone like you that could help her through this? And he did, and he came at it from an approach of kindness and love and understanding, and the information that he went to first, he then cross-referenced with someone that he considers to be trustworthy and in the field and reliable, hopefully, as a source to him. And I just thought it was a beautiful reminder that the information available, that like pop psychology, popular opportunities to learn about this topic can really do wonderful things for our for this generation. So, you know, again, he didn't approach her from a shaming perspective. He approached her with compassion and with you know, this may be something you're experiencing. Can I help you if you want to talk to your parents about this? It's promoting that help-seeking behavior. And our community, when our community is more aware and the younger generation continues to grow and helps their future children and whatnot to understand mental health as a holistic part of our overall well-being, from in utero through the day we are no longer here, it builds more supportive communities. So it's wonderful. All right, normalizing a conversation. It didn't feel so awkward for him, whereas maybe when I was younger, it might have felt a little awkward for me to make an accusation or something like that someone's struggling with, you know, anxiety. But in this generation, at least what I was witnessing with him and with some of my patients and families, is that there's a normalization there. There's an empowering that happens when it comes to talking about, you know, symptoms, concerns, things that people are going through. Increasing awareness, empowering individuals. We got that encouraged shared peer experience. I loved the panel today. They were all, you could see them nodding to one another as they were responding, knowing that they understand and they're relating to the things that they're each seeing and experiencing at their different schools and in their different lives. Previously, an individual might bottle something up, feel very isolated, or interpret it as there's something wrong with me, I'm broken. But out there in the community, they're learning that others are experiencing similar things, and it means that there is an opportunity for help. I told you I had a lot. Some of this, honestly, is just rephrasing what I've said in different words. But I think that some important parts of this generation and what pop psychology allows is for the continued identification, exploration of self, the questioning of, you know, who I am, a little bit more discernment between, kind of like what I mentioned with the procrastination and ADHD. Is there more here for me to learn about? Is there more that might indicate I have a diagnosis of ADHD, or is there not? Is this something, another opportunity for me to gain some skills and work on that? Access to services. There's a lot of things that are available, and again, bite-sized pieces of information, as long as we're, you know, I'll get to recommendations, but making sure that these are valid sources. I get to get into brain health. You know, I feel like I can't say anything better than was said by our first speaker, that neuroplasticity, our brain health, how our brain is functioning, has everything to do with how we're managing our mental health, how we're able to regulate our emotions, our executive functioning skills. So much of it's our control center. So we want it to be as healthy as possible, right? All right, let's talk about a teenager that's maybe got on their phone and they'd like to explore the topic of depression from the pop psychology world that is theirs today. And they may look for a topic of depression and start scrolling through YouTube shorts or something like that. And this information is coming at them pretty quickly. The prefrontal cortex, you all know, is our brain's CEO. It is responsible for impulse control, regulating our attention. It is not fully developed until mid-20s. And so especially in the adolescent years, it's kind of competing between regulating attention span and also novelty and newness and kind of seeking that stimulation, those dopamine hits that come when something is kind of different or new. And so the prefrontal cortex is very much involved as pop psychology scrolling, kind of getting this information is happening. And the positive side of that is that the prefrontal cortex wants to learn. It's seeking of information and it's looking for topics of interest that it's desiring to acquire and to learn about. And on the negative side, unfortunately, is that this overexposure can reduce the critical thinking components. That the brain at some point, that attention seeking, or not attention seeking, that attention, it's seeking that stimulation and the dopamine hits can overpower that part of the brain's desire to learn. And because the platforms are again, they're designed to be entertaining. It's a cute person talking about this and whatnot. And that's, I'm going to scroll into something my brain, that part of the brain, especially in adolescent years, is seeking that. Versus, at a later stage, fully developed, is maybe navigating that just a little bit differently. The amygdala. Our emotional alarm system. The amygdala, we know, is responsible for our emotional reactivity. It is the stress response. It is, it's also where our fear response comes in. And as they're scrolling, the amygdala is lighting up because there's content that is emotional. There's dramatic therapy disclosures, or there's topics that, gosh, they're emotional. And there's a fantastic part of that. And that's that, their emotions are being validated and they're relating to the content, and their brain is scrolling and recognizing that these are things that I can also feel for other people. And yet in the adolescent brain, one of the downsides of that is that it can lead to anxiety. It's not unlike what you and I experience. We turn on the news and it's like murder, this, and a car crash here, and this on the other side of the world, and you're just sort of flooded. And it's, maybe another term, but like a trauma mini cry. It's our body's physiological reaction to what we're absorbing, what we're fueling our brains with in a moment. And we've all had to shut off the TV or give ourselves a cleanse from some of the things that are coming at us and contributing to a feeling or an emotional space we get into. And that's a lot of what pop psychology in its really, really quick exposure is contributing to for adolescent brains that are already enduring so much and not necessarily have the years that some of us have to put that into context and to understand it on a different level. We also have the hippocampus, and the hippocampus is responsible for learning and storing these memories, which is really cool because it's consolidating what's learned and it's giving the brain, again, that like A to B, that, information coming in, here's the answer, I'm storing that. And this can be wonderful because in these YouTube videos or whatnot, there's some really catchy therapeutic triggered and boundaries and things that increase emotional vocabulary, and they increase someone's ability to describe in a different way. If they didn't have that exposure to that language, they might not be able to define what their experience is with such nuanced words that are coming their direction and they can relate to. So that's the positive part. There's, it can normalize help seeking. It can give these vocabulary and these words. And the downside is it can be misremembered. You can hear something again to the 80+% that's inaccurate or misleading. It can get stored, and then that their brains that are developing this initial wire to what this means can be inaccurate. So then when they experience something, like again, the apple or the red Skittle or whatever it was that I was thinking of, right? Like it gives one or two pieces of information and automatically is going to, oh, well, I must be on the autistic spectrum. I must have OCD, right? And so that's kind of sort of the downside if there's not the context that we want to have to really teach this information as accurately as possible. And I love talking about the default mode network in adolescence because the DMN is where we reflect. It is the part of us that develops that inner monologue. And as our teens are scrolling through the videos, they're relating because it's relatable. It's designed to be. And so they're saying, oh my gosh, actually, is that me? Do I have that? Do I need to, get a medication for that? Or I better talk to somebody because man, I've got issues. And so they're doing kind of this anxious reflection and sometimes at times defining themselves by things that could or could not be really truthful of what's going on. The DMN is highly active during adolescence because that's when a lot of identity is being developed. And social relationships and what we hear socially is really, really important at this stage. Totally developmentally appropriate. So that self-reflection, identity exploration, my mind is important throughout life. I think we should always be self-reflecting and always, have a growth mindset and, want to learn more about ourselves and the world around us. And yet on the downside, after watching some videos, someone may ruminate for a while on that topic. Gosh, I saw that video. I saw 3 videos that made me think that this is me and I'm having this struggle. And one of the great things is that could lead them to seeking answers and seeking help. On another, it can lead to some kinds of confusion about who they are or what they might be going through. And so we just, again, have to help take the information they're receiving and ensure that it's getting clinical eyes so that it's accurate. Clinical recommendations. In therapy, when we do psychotherapy, we have spent years learning all of the evidence-based practices. We're learning and have an obligation to work with our patients from orientations and clinical approaches that are evidence-based. We want to support our patients the best ways possible. And pop psychology is not necessarily evidence-based. And so when a patient comes to us, we want to validate and understand, man, all the teens said this today. Like just empathize, just, recognize, kind of be non-judgmental. I couldn't have said it better. I think that that's so important. I have done a little bit of research or digging into some things that are available and really popularized, and maybe some of you haven't, and that's okay, but there's apps for shadow work. Has anyone heard of like shadow work apps or trauma dumping apps? Or there's one that I read about called Replica. Anyone ever heard of that? Replica is an AI chatbot, and it's designed to be like a companion therapy-esque kind of companion. And the problem is that it's not designed by clinical psychologists. It isn't rooted in these evidence-based practices, and it can often unintentionally, I guess, based on the algorithm, like lead people down the wrong path or contribute to perpetuating maladaptive strategies that individuals are learning about. And unfortunately, I listened to a podcast recently, and the podcast was talking about AI. And I know this isn't about AI, but again, AI is a part of where pop psychology is. AI is designed to be very validating, and it's designed to be keeping the user engaged. And unfortunately, in the podcast, I heard about a youth that died by suicide, and that you guys heard that? Yeah. And it just, blew my mind to, for the family to feel, gosh, there must have been some bullying, there must have been something on social media, and really found that longstanding relationship with AI, where you could see safeguards, right? Asking about painless ways of dying. And when the AI almost guided a way around that, it's just kind of scary that these things are out there. And I personally, I was like, this is nothing that Google, you can't already find on Google. It's not, we're giving that AI a bad rap, but the truth is that it comes in that form of the friendship, the relationships that's developed, that AI sort of memory that's in place when it's engaged with over and over. And it's not a Google search that yields 50 things you got to click through and, read about. It's direct, it's very personalized. It feels, just such a strong sense of validation that we've really got to teach some caution around that as a replacement to clinical work. So yes, so this they said beautifully. We don't want to shame. We don't want someone to come in and say, I saw this TikTok and I think that I have OCD, and then we just go instantly like, well, I don't know that TikTok, and TikTok doesn't know anything. We want it to be a bridge. We want to be curious about what is relatable in that. What are you seeing in yourself? And I think that bridge can help us to get to some true spaces of diagnosis and identifying and treating with that shame component being removed, because information is out there, and it's great that leads us to a starting place. Okay, content evaluation. This is a skill that, man, we all need because we are all inundated with so many different, viewpoints, information, and critical thinking, or asking ourselves about the source. We don't have time for that a lot of times, but when it's an important topic, we've got to be a little bit cautious. And it's a silly example, but my husband is he's a football player, he's a coach. I'm in psychology, obviously. So I tell my kids, if you want football advice, and I start telling you about that, play or whatever, are you gonna believe me, or maybe you want to ask your dad? And they're like, oh, I get it, because the source is important. That you want to make sure that the source that's giving the information is doing so. I might do it in a fun way. It might sound great, but it's not going to be as reliable as talking to their coach father. So these skills that we get the opportunity to teach, and wherever you're at, for ourselves, for your children, your patients, families, one another, it's really goes beyond just learning about mental health, but many different topics that we face and are sort of inundated with all the time. And again, I think a developmentally appropriate approach is important for that too. Oh my gosh, wow, I went through that quickly. But okay, so I have another story to close with. And this one is about my 12-year-old, Max. He just recently kind of got some new privileges on the internet. And so, throat's getting dry. So I was making dinner one evening, and he is sitting, next to me, and he's looking stuff up, and I'm kind of paying attention, but not really. And he closed the laptop and he said, Mom, I really think that I'm on the autistic spectrum. I high functioning, but I think I'm on the autistic spectrum. And I might be traumatized by the second grade teacher, that one substitute that was so awful. And that substitute was not great, but he wasn't traumatized. But I took a moment and thankfully paused and recognized that he was looking for information about autism, because my 4-year-old nephew, his cousin, was diagnosed recently on the autistic spectrum. And so he was learning. He wanted to learn, what does this mean? How can I, understand what's going on? But I had asked him, again, because that took a breath. And before I went into education mode, I just said, what did you relate to? What about the video that you saw, some 30-second, I don't know what video, but you know, what about that sparked your curiosity about yourself? And he went into some detail. He's definitely more of my likes to go and do artsy stuff in his room by himself than being out. And he's like, I just, just went into some detail about where, what he was thinking about with this video. And it led us to a great conversation. And then I was able to interject some, differences between how we are as individuals and our personality traits and our likes and our dislikes and introversion and extroversion and blah, 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 probably more than he cared about because it wasn't 30 seconds. But it was, for me, it was a moment that was kind of it was a cute moment, but it was a wake up call to remember that not only children, but adults, we get a lot of our information from sources and we have a lot on our plates. So we want information that's quick, and we tend to kind of, seek out these ways that we can get the answers and move on and get another answer and move on. But that this generation in general, I find to be very strong advocates for themselves, for one another. I find them to be fluent in the language, clearly they're fluent in the psychological terms and the language, which is fantastic. And I think we have an opportunity to use that and leverage that to again, build that bridge and to create continued dialogue on these topics, to find that balance between what's, destigmatizing and then not to desensitize and believe that, if everybody's one thing, that again, there's nuances and that we can work on to kind of discerning that together. Let's see. So social media is not going anywhere. AI is not going anywhere. TikTok is not going anywhere. TikTok can sometimes be like the new therapist. And again, I think that we have to embrace what is and not be overly harsh about it, as much as I want to cringe when I hear some of the psychobabble terms, but it's not going anywhere. So to kind of leverage it for what we can. Like I mentioned, destigmatization is great. It's super powerful. We have an opportunity to continue creating awareness, which is wonderful, and really, I think also helps us not only from spreading knowledge, but to be honest, like getting more funding for the treatment, acknowledgement, and services that are available to treatment in our community. We have an opportunity also to teach media literacy. Like I mentioned, that we can be curious, what did you see in that video? Who do you know that maybe created that video? And also that, like, this is a question you have because of what you saw or read or heard. And now what is there an expert or someone that we might be able to find to talk to and validate that, or maybe teach us differently? And I also think as clinicians, anyone in practice, you can incorporate this into your intake process. If you're working with a youth or an adult, or honestly any ages, but to ask if there's something that you've read about or seen or found on the internet that gives you more information about that, or what does your media use look like? What does your social media use look like? It can help us to kind of start those conversations and to even have them retell what they've learned about. And that's then maybe our opportunity to guide and validate some of that, or correct or educate, and just use that as something that's not shaming, but is starting the conversation. Because so often, honestly, whether it's a TikTok or a video, it's a conversation starter. And I believe that's a really positive thing. Some references for you guys. I found all those different studies I threw in there, and I would love to take, I don't know how many minutes we've got, but a minute. Last minute. But for any questions or stories that you guys have, things that, yeah.
Just really quickly, how soon, since you work at PCH, will they diagnose any kind of mental health issue with a child? Or even an infant,
Yeah, we work with all ages. Again, you know, my passion in perinatal, I sort of helped to build a perinatal mental health program, which has been great working on really focused on maternal mental health through pregnancy and sometimes because we're a medical hospital, diagnoses for the fetus that are difficult. So helping support parents' mental health as they go through that period of time. And then being able to work with children in those early stages, often that goes hand in hand with that parent-child dyad. But then throughout the adolescent years, we're working to diagnose and treat and support that from like a holistic lens. So not only the mental health, many of our patients also have comorbid medical diagnoses too that we're looking at.
I would say an example of like the whole pop psychology and social media. I was just at a high school the other day and, you know, I just happened to pass by a bunch of teenagers who were in conversation about a couple of kids who are autistic at the school. And one child told another, I wonder if that parent took Tylenol in Europe, you know? And it really got me in that moment. I thought, wow, you know, how fast was that? You know, because that was just a few days ago, so.
Yeah. Absolutely. I had a lot of families come my direction after that to ask and just, what is this? I'm feeling, you know, level of guilt or, you know, what is this real? What's not real? And yeah, we can, you know, spread information, not only through TikToks, but honestly, there's this pro con too of celebrities sharing their stories, which is great. I think that we can see that, you know, like real people are sharing and helping to create destigmatization. And, you know, and yet sometimes misinformation can come from a source that's an important person or role, and then that can rapidly spread information that's not entirely accurate.
Well, what motivated the content creator for Orange in the Shower, right? Like, are they really making copious amounts of money doing that?
Right.
And so I think that's sort of what drives this too, is there's like an economic piece to it, and that does scare me because it takes away from the validity and the economic use of what professionals do.
Yeah, I agree. I agree too.
Yeah.
Any other questions or stories or, you know?
I have a question. Where can we get some of the information, and maybe can we get one of the slides of references so we can take pictures?
Yeah, you can go back to that. It's not too, well, I can blur it out in there, but please feel free.
And I'm a middle school social worker, so I have all types of stories on my.
They
break up.
Yeah.
They use Chat GPT to break up with each other.
So like a background info, so I'm about 35 years old. I was just recently diagnosed with PTSD. And so with that though, being, you know, who I am, also a father as well, seeing how it affects kind of like, it's changed relationships with me within the last like few weeks. Some for the better, you know, some for the worse, due to some of those stigmas that I've grown up with, you know, in my communities. It is something that is very like taboo. It is something like we don't speak on that. You know, that symbolizes weakness. In our family, that's not allowed. So what I found is my story, or, you know, some of the things I speak about resonates more with the younger generation. And then I've also found that family members, some of, you know, within arm's reach unexpectedly and unknowingly also share some of the same traumas that I went through as well. And it was only then when it was someone they trusted or whatever, I grew up with them, you know, some of my partners and stuff. And they were like, yeah, you know, that happened to me too. Or this X, Y, and Z happened to me too. And so at that point, later on in their life, they're able to really start doing trauma work, and they're more open to the conversation and having that space. So in your profession, what are some things that I know your topic is about pop culture and all that good stuff, but from your perspective, what else would you, what kind of guidance would you give somebody that's trying to essentially fill those gaps with different generations that have already been instilled with that type of mentality?
Yeah, you nailed something. I think that is, you know, it's part of why I love this topic, is because I find myself sometimes being like the like older lady and me being like, gosh, kids these days. And yet also the words of generations before me that like, crying's not going to solve anything. And just grin and bear it, or, stuff like that. And I think that what's important is what you alluded to is being able to be honest and forthcoming, brave enough to share your story, and to also, I guess, keep some of that protective layer for yourself, because there's people that will understand, relate, and you'll be an inspiration to people that can then, feel safe enough to talk about it. And also then recognize that there's some that won't. They've got a firm belief, this is how they're feeling, and hopefully, we'll one day kind of find a middle ground. But I think that that's a piece of it, is to not stop talking about it. And again, that's why I do value a lot of this. I try not to cringe. I just don't want to take away from, I don't want someone to say, like, again, pop quiz gave me PTSD, when the struggle with PTSD can just be very debilitating. And so I fight with that, where I want us to be able to have the conversation, but I wouldn't say like, oh, my cancer is, because I don't have cancer, right? And so it just, mental health is not as visible. We see external components of it, but unless we can all get those brain scans and walk around like holding that and being like, see what I got going on, we just have to be able to have that sensitivity. And the kids said it too. They said, like, just be aware, we've got these invisible backpacks, they are heavy, and I don't know the way to yours, you don't know the way to mine. So let's, have some compassion. A long-winded answer, or just additional thoughts,
Thank you so much.